Many times we see lot of pigmented spots on our face, or we observe that our whole face is getting more pigmented. So what are the different causes which may cause pigmentation over our face? So first of all, if there is pigmentation over our neck, our underarms, and there is thick velvety skin behind our neck as well as over our forehead, then it is due to acanthosis nigricans. And in this condition there is insulin resistance in our body. Generally there is weight gain of the patient, and if we check cholesterol, then that also is increased, that is there is impaired lipid metabolism, lipids are increased. So while treating this condition along with dermatological treatment, patient is advised to do lifestyle changes, that is to have weight reduction, along with that diet control as well as exercise, because the main hidden cause behind this pigmentation, it is not due to tanning, because patient try to remove it with the help of soap, but it does not get removed because it is not only external, it is from internal, and that is due to insulin resistance. So if we want complete treatment, then the patient has to decrease weight and patient has to do diet and exercise. Second most common pigmentation which we see over the face is melasma pigmentation, and it increases when exposed to sun. So melasma patients are advised to avoid sun exposure and to avoid use of certain creams for a long time, like steroid creams or hydroquinone creams should not be used for a long time, because due to inadvertent use of those creams, melasma with gradually over the time it starts getting more darker and darker. That's why dermatologists do rotation of the creams. They do not give same cream for a very long period of time. Similarly, many times there is pigmentation seen around the mouth, that is perioral pigmentation and lip pigmentation, and that is due to lip lick dermatitis, in which the patient has a habit of licking the lips like this while talking, and due to that some digestive juices which are present in the saliva, they interact with our skin over the lips, and then there is pigmentation of that area. So along with tablets, creams, the patient is advised to stop that habit of licking the lips. Then sometimes there is itching, redness and dark pigmentation seen over side of the nostrils, over our chin, as well as over the scalp and behind the ears. So this is seen in seborrheic dermatitis. In this condition, sometimes in the males there is itching and dandruff like scales over beard area also, and this condition is worsened by stress and in winter. So in this condition, dermatologist after examination will give some antifungal tablets, creams and other treatments, and after stress reduction, the bouts of this seborrheic dermatitis, they get decreased. Sometimes there is periorbital pigmentation which we call under eye dark circles. These under eye dark circles, they have many causes, like it may be due to stress, it may be due to prolonged use of the screens like mobile laptops, it may be nutritional also, like deficiency of folic acid, iron, vitamin B12, or it may be due to acanthosis nigricans also. It may be seen in certain allergic patients due to constant rubbing of the eyes, or it may be sometimes due to heredity also, there may be dark circles. So sometimes patients try to remove the darkening by rubbing, and due to constant rubbing this darkness is aggravated. So we should avoid friction and rubbing over our face, and sometimes some people have habit of bathing with scrubs or with stones, so we should avoid that excessive rubbing of our skin. Those who have allergy, they can get pigmentation due to various chemicals like hair dyes. After application of hair dye, there is itching, redness and pigmentation seen over our face also and on scalp also. So we should avoid hair dyes. In such cases, they should apply red henna, or they can apply the hair dyes which do not contain PPD and ammonia, and they should apply after doing a patch test. Second is bindi dermatitis, in which over the forehead there is itching, redness, and there is pigmentation over the forehead. So in that case the patient has to avoid bindi or kumkum because chemicals present in that and adhesive in that causes, when comes in contact with the skin, that causes the hyperpigmentation. So they can use some kumkum which is devoid of that chemicals. Then if in cases like in monsoon season there is parthenium grass everywhere, and due to contact with that they get itching over the exposed part like face, neck, arms. So they should avoid they should cover their arms as well as face while going outside. They should avoid sun exposure, and they should avoid all the perfumes the fragrance related, all the flowers. So they should avoid Dettol also. Many times patient thinks that is itching due to some organisms and they apply Dettol more often, but they should stop that because due to Dettol that skin again becomes more dry. So the Dettol itself can cause itching. So those who are allergic or those who have dry skin, they should avoid fragrances as well as Dettol. In old age there is on the face there is pigmentation due to lentigens or solar lentigens or solar keratosis, and in that patches are seen, pigmented patches. In some fair skin people there are freckles are like moles only. So when the dermatologist will examine that, then he can come to the diagnosis. Sometimes it is hormonal, sometimes it is nutritional, sometimes it is thyroid deficiency, thyroid disorders, or there can be Addisonian pigmentation, there can be lichen planus pigmentosus. In this condition there is pigmentation over face as well as over the body. Sometimes biopsy may be needed and to confirm the diagnosis, and then different types of medicines along with creams and procedures are needed, like sometimes there can be birthmark over one cheek. Then there is need of the lasers like Nd:YAG laser, CO2 laser, and many sittings are required. There is a peeling treatment, chemical peeling, in which chemicals are applied and then dead skin is removed, and then it is done in sessions. So like this you can have relief from your pigmentation problem after consulting your dermatologist.